Complications of lung cancer. Lung cancer is a serious disease that can cause a number of complications. Some of these issues are related to the progression of the disease as it spreads to other organs, and other complications can be caused by therapies used to treat lung cancer, including chemotherapy and radiation. Lung cancer can cause complications such as excess fluid around lungs or pleural effusion. Lung cancer can cause fluid to accumulate in the space that surrounds the affected lung in the chest cavity. This is called malignant pleural effusion, and it can cause pain and shortness of breath. Treatments are available to drain the fluid and help keep it from building up again. Blood clots. Lung cancer can increase the risk of blood clots. This occurs when a blood clot develops in a deep vein, especially the lower leg or thigh. A blood clot can be life threatening if it travels to the lungs. This condition, called a pulmonary embolism, can prevent blood flow to the lungs. Medicines are available to dissolve clots before they cause serious damage. Coughing up blood or hemoptysis. People with lung cancer may also experience hemoptysis or bloody sputum when they cough. Sometimes bleeding can become severe. This may be due to bleeding in the airways or coughing, causing irritation to tumors. Treatments are available to control bleeding. Higher risk of infection. Some cancer treatments, such as chemotherapy, can significantly reduce the number of white blood cells that the body needs to fight infection, most especially neutrophils. Low level of neutrophils leaves a person vulnerable to all sort of infections. Metastasis. Lung cancer can spread to other parts of the body such as brain, liver, bones, and adrenal glands. It can cause significant side effects depending on the area it spreads to. Treatments are available to decrease signs and symptoms and to help you live longer. Hypercalcemia. Lung cancer can lead to increased levels of calcium in the blood known as hypercalcemia. Symptoms include thirst, nausea or vomiting, stomach pain, feeling tired, weakness, feeling dizzy, and frequent urination. Spinal cord compression. Metastatic spinal cord compression can happen when a vertebrae collapses due to damage from cancer or if a tumor develops and presses on the spinal cord. Symptoms include neck or lower back pain, weakness, loss of sensation in the extremities. Spinal cord compression is a serious complication of lung cancer that affects around 4% of people with metastatic disease. Neuropathy. Neuropathy occurs when there are tumors growing near the nerves in the arm or shoulder, and when a person experiences numbness and tingling in the hands and feet due to damaged nerve tissue. Facial swelling. It can occur when tumors in the lungs obstruct the flow of blood in a blood vessel known as the superior vena cava. Mental health. Receiving a lung cancer diagnosis can severely affect a person's mental health and lead to depression, sleep problems, anxiety, and weight changes. It can increase the risk of suicide. Anyone who experiences symptoms should seek guidance from a healthcare professional to improve the mental health and quality of life. Treatment complications. Treatment for lung cancer involves chemotherapy, radiation therapy, targeted drug therapy, and surgery. Each treatment will have different side effects, but common problems include increased risk of blood clots, difficulty swallowing, dry mouth and mouth sores, bone problems, difficulty thinking and functioning, mouth and dental problems, diarrhea, constipation, fatigue, hair loss. Loss of appetite, nausea, vomiting, peripheral neuropathy, pain and discomfort, skin reactions, changes in weight, edema, reproductive changes, higher risk of infection, bleeding, anemia, anxiety, or depression. What can I do to reduce my risk of lung cancer? There is no definitive way to prevent lung cancer, but following preventive measures may lower your risk. The best way to reduce the risk of lung cancer is to not smoke and to avoid second-hand smoke. Cigarette smoking is the number one risk factor for lung cancer, causing about 90% of lung cancer cases. Get your home tested for radon. Use a home radon test kit to identify and allow correction of increased radon levels in the home. Radon is an odorless gas that is emitted from decaying natural uranium in the soil. It's the leading cause of lung cancer in non-smokers and the second leading cause of lung cancer overall. Exercising and eating a healthy balanced diet help reduce the risk of cancer. Try to exercise most days of the week. Eat more fruits and vegetables. Eating a variety produce is considered more beneficial than eating a specific fruit. Avoid taking large doses of vitamins in pill form as they may be harmful. Cut down on how much alcohol you drink. Drinking alcohol increases the risk of certain cancers. Get screened. If you are a smoker, annual screening for lung cancer can be beneficial if you have a history of heavy smoking as measured by pack years. Doctors recommend a screening test to find a disease early when treatment may work better. The only recommended screening test for lung cancer is low dose computed tomography. Who should be screened? Lung cancer screening is recommended only for adults who are at high risk for developing the disease, that is, people who have a 20 pack per year or more smoking history and smoke now or have quit within the past 15 years and are between 50 and 80 years old. Thank you.